We'll be getting started in just a few minutes. While we're waiting, if anyone attended the Certified Dementia Practitioner trainings and you did not submit for the certification or for the nursing continuing education and you would like to do so, we know there's a few people who attended who haven't done that. Please reach out to myself and Jennifer, and we want to get that squared away because we want to make sure you get that certification and that those nursing CEs if that applies to you. So please reach out to myself and Jennifer if you have not submitted that. And this is a reminder that this will be our last weekly session. We'll be moving to monthly sessions in August, and we'll be following up as to get that curriculum squared away. We're going to be continuing to take your all's feedback and use that in the development of the curriculum. And we'll look forward to seeing you on the first Thursdays of the month starting in August 4th. And Pam, I just saw you joined. Would you like to say something about the advanced care planning evaluation?
That was to me, correct? I'm sorry, I just jumped on just in the nick of time. All right, great. Yes, hi everybody, Pam Yankee-Love here. So yes, there is an email that should be somewhat in the top of your email box today because I resent the email that's asking about a Flourish Connect Advanced Care Planning survey. And in that survey, it asks for you guys to share how many individuals that were 65 years and older were in your facility from June 1 to June 30, and then it asks 3 questions about related to advanced care planning with those individuals that were in your facility from June 1 to June 30. This is something that is required by HRSA. It helps us get a sense of where everybody is before we receive some training on advanced care planning in the maintenance phase that will be here shortly. And then what we'll be doing is that we'll do this again. So if you can't find it or you have any questions about it, please feel free to go on and email me. I will put my address in the chat. You can also reach out to Ellen if you'd like to reach out to Ellen. There was about, when I looked this morning, there were about 13 facilities that answered the questionnaire. There were another 19 that were in process, which is very promising. So if you have any questions, you just let us know. And there's also, I went on and asked a question at the end of it in case there are some specific things around advanced care planning that you would like us to address in the future. For example, some folks said it's kind of hard to do advanced care planning in a short-term acute facility. So we were asked a question about whether there's some specific things that you might want to know about advanced care planning, so we can incorporate that into the training. So thank you so much. Yes, and I know that in the chat, it's only one is needed per facility. So yes, we do send it to the nurse administrator and the, I believe, data analysts that you guys may have identified in the orientation survey that you did way back before we had our very first session. So I thank you in advance for this, and feel free to email me if you have any questions. And I did go on and extend the deadline. So I extended it another 7 days. Okay, thank you guys.
Thank you, Pam. Sorry.
It gets confusing. It's fun.
Occupational hazard. Again, we always have a short survey at the end, and this is week 24, so we really appreciate you completing that. And today's speakers have nothing to disclose, so I will introduce Sam Cotton and Barbara Gordon.
Hi, everybody. How are you all doing today? Hope everybody's doing good.
Good afternoon, everyone.
So today we're going to be talking about cultural competency. And before we get started with our discussion for today, I just wanted to do a quick check-in and see if anybody had anything pressing that they wanted to discuss, any cases or anything of that sort. It doesn't have to be relevant to cultural competency, but if it is, great. And if you have anything you'd like to discuss, you can go ahead and put that in the chat or unmute yourself, whatever works best for you. So we'll take a moment here and see if anybody has anything. Okay, well, since everybody's quiet today, we'll go ahead and get started. And if you think of anything, feel free to jump in with any questions or comments or just cases or resident related issues that you might be dealing with. So today we're going to be talking about how to foster cultural competency in our nursing homes. And I thought it might be good to start with a case to really kind of talk about how this can really be impactful in our nursing facilities, even at a very micro level, and better understanding this and being more culturally competent. So this case actually comes from a nursing facility that I've worked with in the past. Was not submitted from anybody from our cohort specifically. And I have changed the name of the resident from what it originally was. But Rita had moved into our nursing facility shortly before COVID. She's Hispanic, speaks both Spanish and English. One of the primary reasons that she wanted to move into the nursing facility was because she was a very social person and she had been living alone in the community for a while and really wanted that social connection with people. And so she had been struggling previously with that and just really flourished once she got into the facility and became very close friends with many of the residents. However, COVID hit, as we all know, and it really caused some struggle for her because she had several friends in the nursing facility who passed away because of COVID. And so staff were starting to become concerned because she was really showed that through the grief process, what they were considering to be extreme grief. So she was crying very loudly, wailing. She also had created a small memorial for her friends in her room with pictures and keepsakes. And at the time I was working with the facility, they were worried about her mental health. And actually wanted to recommend medications maybe to help with this issue because they thought that, she wasn't dealing with the grief of everything well. But really, it's important to think about cultural norms in these situations related to death and dying and grief. And for Rita, in her culture, showing or expressing grief was well within, the normal parameters of what she was raised to do, taught to do. And so this was nothing outside of the ordinary for someone in her culture to do, and especially related to creating the small memorial for her friends in her room so that she could really honor their lives. That's something that's a custom in her culture. And really the role of spirituality in her life as well, really helped her with this grief and processing it. Now, it didn't look like how staff thought it was supposed to look like, but within the parameters of her culture, it really fit. So she was actually grieving well in this particular situation. And so I think what this highlights is that sometimes, we make assumptions based on our own cultures about things with residents. The same can be said for staff as well. Sometimes we will often find ourselves in situations where we make an assumption about something, and that causes, an issue related to either communication or even just within the facility at large. So even the small things, and I know that, I gave you an example where it was kind of easy to apply the understanding about her culture and being person-centered related to Rita's care. But sometimes we see that there might be a juxtaposition between some of these areas or some of these issues between what the facility needs to do versus that individual's cultural norms and what they value and what they believe. And so if you have any examples of that you want to share throughout, feel free to do so. I think it's really important for us to kind of share those examples because it can help us process and frame strategies for working with individuals and being person-centered. And that's all at the heart of cultural competency. So we've spent the last 23 weeks, we're in week 24, focusing on the 4Ms of age-friendly healthcare. And I'm wondering, I want to ask you all where, when you think about cultural competency and some of the aspects of it, where do you think it fits in related to the 4Ms? You can type in the chat, throw out, unmute yourself. Yes, what matters? That's a perfect example. It really does fit very closely in what matters because we're honoring that individual's, their values, their preferences, how that can, really guide their care in the nursing facility. Justin made a really good point earlier in the previous session. You were talking about medications and mentation and how they fit as well, Justin. And I thought those were really good examples with medication for some individuals from different populations. Different medications might not be in alignment with their values or belief set. So I use the example of, I know in Middle Eastern cultures and religions, some of the medications that we prescribe, often the casing is made out of meat or has some sort of meat byproduct in it. And so individuals within those cultures don't want to take those medications. Like they want to know where they're coming from, right? And what they're made out of, because that's in juxtaposition to their belief system. Within mentation, just want to highlight there that a lot of the assessment tools that we use to assess cognition should also be very culturally sensitive, but they're not. So for example, the Montreal Cognitive Assessment, which is a very common tool that we use, it often uses depictions of animals that you have to name as part of that cognition test. And depending on what culture you're from, you might call that animal a different name, or you might not have been raised in an area where that particular animal is. And so therefore, you're not going to be able to answer those questions. Same goes for the rapid cognitive assessment, that screening tool that's very commonly used. And I feel like several of you are probably using that one because it's pretty common in nursing facilities. There's actually a paragraph that you read aloud to the person and they have to respond. And I believe the answer is like Chicago or something like that, or maybe it's Illinois. And embedded in the paragraph is the clue is Chicago, or vice versa. But regardless, that's kind of predicated on you having lived here and being familiar with, geographical cities and states and stuff like that. So again, while I try to make those tools sensitive, they're not always culturally competent tools, and we have to be mindful of those things. Mobility could also be touched here as well. So a lot of times when we talk about adaptive equipment like canes or walkers, depending on what culture somebody grew up in or adheres to, those might not be common tools that are used as one gets older, and they might have negative perceptions of those. And so getting residents to actually use them can be difficult sometimes. So again, these are just all pieces of the puzzle when we're talking about age-friendly healthcare, and cultural competent healthcare fits into all of those. The same goes for trauma-informed care as well. I don't necessarily have a slide about this, but really thinking about trauma and how within different cultures it's conceptualized and discussed or talked about is also important. And Daynell says, understanding other religions is important, especially when it relates to mentation. Yeah, in terms of also, I think where you're going with this, Daynell, is from a behavioral health, mental health standpoint, and how people either seek help in those areas, or maybe not necessarily, or how they even view that particular piece too, to drive there and conceptualize their own joy. So again, it fits into every piece, but the most important one is the what matters most, and how we can really be patient, resident centered in the care that we're providing, and this is one way to do that. And I think it's important to recognize that our residents come from all different backgrounds and have a multitude of experiences, and it's really important to lean into that concept. You know, a lot of times when we talk about nursing homes and community, we kind of separate them, right? We talk about this is what happens in a nursing facility, this is what happens in the community, right? And never the twain shall meet. And really, our nursing facilities are kind of this microcosm of representation of what's happening in our community and the diversity that is present there. And so we really need to honor that. It really is not a cookie cutter approach, right? As it relates to the care that we provide. And we all recognize that. I think across the board, it's just being more intentional about that focus on a cultural competency. And I just want to stress too that the same extends to our staff as well. All of our staff come from different backgrounds and have a multitude of experiences, right? And so understanding that and really being able to honor that is important in terms of not just that staff development piece, but building that safety and trust with staff. I know that we've all talked about the different issues related to staff retention right now. So, you know, prioritizing this and being more intentional about this in these conversations can be really critical in terms of that staff retention piece at this moment. So again, we're going to focus a lot more on the resident piece today, but I think a lot of what we're discussing is very staff focused too. And very important to that mutual understanding. And a lot of times miscommunication happens when we're not engaging in that culturally competent care piece. So let's launch in. I know it seems like this was like the slow introduction to a TV show or movie or something, but I want to now take a step back and us talk about what cultural competency means, because I keep throwing that out. And if this is your first time hearing that term, you might be like, oh, I get it. Like it makes sense logically, but you know, I want us to kind of dive in a little bit more in detail. So let's hear from you all. When you hear that concept, what does it mean to you? You can type it in the chat. Unmute yourself. What are your first impressions when you hear cultural competency? All right, I'll give you a hint. Oh, here we go, Justin. Adapting my interactions to the person in front of me. Justin, you want to elaborate on that?
I just realized, like, especially like just coming from a conference and, you know, being around a bunch of different types of, you know, people from all over the country, really, just recognizing how much, you know, it's like you need to kind of adapt to the person that's in front of you. And, you know, I think a big piece of that is dignity and respect, and really trying to honor who that person is, and dropping a lot of my own perceptions on things, or at least modifying my you know, what's going on to the person that's in front of me, especially if I'm in a caring situation. Like when I was doing hospice care, like I was always, you know, having to tailor what I did to the person that was in front of me, whether it was physical or whether it was their beliefs, or, you know, who they were as a person.
Yeah, that's all part of it. Daynell says, understanding our willingness to learn about how others view the world and even themselves. Okay, so listening, I think, is a huge part of that understanding piece, right? I need a lot of work because we do not have a lot of cultures in our facility. So I think, you know, to that point, Diesta, it's one of those things related to also when situations come up, because we're never going to know. and I'm going to say this over and over again, I'm going to sound like a broken record by the time this is all said and done. As it relates to that, and Barbara did an eloquent job this morning of talking about the humility piece, the cultural humility. And, we're never going to know everything about a specific culture, right? It's just not possible for us to be that well versed in everything. But it's about when you're working in these spaces and you encounter something or a person from a culture that you're not familiar with, it's investing that time into educating yourself and learning more about that particular space that individual is in and what that looks like for them, and just what that value set at the very basic level can be for that individual. And then Scott says not being afraid to ask questions as well, but not making assumptions. So these are all really valid points. I just want to highlight, in terms of what we talk about, it's really about being able to provide that care that focuses on the diverse values and beliefs and behaviors of individuals, but tailoring that service delivery to them too, to meet those unique needs. So sometimes that means that we need to pivot what we're doing in terms of the service delivery piece to our residents to really be person-centered and focus in on, what is it within their culture that they value, and how can we make sure that fits into this overarching system. And having those larger conversations, and to Scott's point, not making those assumptions, because that's a huge piece of the puzzle, I think, is really leaning into listening and having that conversation. And I also want to highlight too that when we're talking about the resident piece, sometimes, especially with persons with dementia, they're not always going to be able to articulate to you that belief system that they have, maybe in a succinct way or a logical way that you're able to follow. So that's where it's important to also have these conversations with family, so you can better understand some of the nuances related to their culture and what they prioritize. I think that's an important piece, even from the beginning when somebody first comes into the nursing facility, so that you can really get to know them better. And when we talk about culture, it means a multitude of things. I want to highlight a couple of things here on this particular screen, but it does encompass all of them. One, when we're providing care to residents, really focusing in on that language and communication piece can be really important, particularly if you have individuals where English is their second language, or maybe they don't speak English at all and they need an interpreter. So really understanding some of those pieces of the puzzle. Also understanding that not, especially in our healthcare system, which we're all operating under, some of that language that we use commonly in our healthcare system, there are not literal translations of that in other languages, right? So then that's where we get into this confusion with residents maybe not understanding their care, or understanding their medications, or what's going on with them related to their chronic conditions. And so just something to keep in mind and to be aware of. The other thing I want to highlight too is relationships. You might see this within families that you're working with within the nursing facility, how they react to each other or relate to each other or even communicate to each other. All of that has this undercurrent of whatever the cultural norm is for them. And so while you might be perceiving that in a certain way, that might not necessarily be what's accurate for that particular family. And then the other thing I wanted to highlight quickly is the expected behaviors. So a lot of times, again, going back to that analogy of using the cookie cutter, right, and taking that cookie cutter approach to things, a lot of times we have this expectation of how people are supposed to react or respond in social settings, that, and that all comes from our culture, whatever that is for you. And so when people deviate from that, we're really thrown off, right? And we don't always know how to react to that. But it's important not to label those behaviors as problematic that individuals might demonstrate, just because they don't, they're not the expected behaviors that you would think that you would see for an individual of that age. And that goes to manners of interacting as well. Again, all of those cultural norms. I remember I've worked with individuals from a number of different communities in my social work career, and I worked with a family who they were refugees from a Middle Eastern country, and I believe they were from Iraq, if I recall correctly. And they had this when they went. I was helping them with their mother getting placed into a nursing facility, actually, and they wanted to bring everybody food at the nursing facility every time they came, right? And so that was in their culture, it is offensive not to go somewhere like that and not bring food. It's considered, rude. But obviously the nursing home was nervous because, they're not supposed to take gifts, quote unquote gifts, from individuals, from families and stuff like that. They had like a policy at the nursing facility. So there was this huge miscommunication between the family and the staff because they felt like, oh, well, we're bringing them stuff and they don't want it. They act like it's not good enough for them. And that really wasn't the case at all. So things like that can be challenging to get through, but it's all part of that, that negotiation that we need to do related to culture and culturally competent care. And then I also want to just discuss the difference between cultural competency, and sensitivity and awareness, because I think a lot of times these words get thrown out, and interwoven in together, and they're not necessarily the same thing. So you might be sitting here thinking, well, I'm totally cool with all people from different cultures. I'm very sensitive to all these things. But really the difference between that feeling of I'm okay with this and is different than that, that action piece that we sometimes need to take, particularly as it relates to care. Now, I know 2 weeks ago, we talked about diversity, equity, and inclusion, and really trying to move that needle towards structural change, right? And within our nursing facilities. And I think it's really important to understand, the same goes with this cultural competency piece really fits into that as well. Really trying to make sure that when we're providing that care to individuals that we're focusing in on, what are those unique values that person has that is important to their care, and make those changes as needed. Not just being aware of them and not doing anything about them can be very that can be difficult, I think, in terms of how we proceed based on a number of different factors, but really making sure we're doing our due diligence, not to just be aware of something and not do anything about it. And I just want to highlight too that cultural competency is a total process. We should always be constantly learning and growing in this particular area. It's not something where you're just, oh yeah, you don't know anything to, oh, I know it all. That's not really how it works with cultural competency. We really need to kind of lean into that. I'm always learning, I'm always growing, I'm always trying to develop my skills. I think, when we talk about cultural incompetence, that those are individuals who, on one end of the scale are viewing themselves as culturally superior to other cultures. Maybe they lack cultural awareness and they think there's only one way of doing things. That might be a lack of having interacted with individuals from different cultures or a byproduct of that. Some might, on this end of the spectrum might say that they see all people the same and everybody should be treated the same. And with that can be problematic as well, even though it doesn't sound as destructive as some of the other components to being culturally incompetent. But what that does is really take that person's culture away from them, right? And ignores all those unique things about that individual or about that group of people that make them, who they are. And so, we can't really ignore those differences that we have. Obviously, we also want to look at the similarities that we all have, but we can't just focus on that. We all have differences. Then when we start moving towards a more culturally competent framework, it's really recognizing different cultures, seeking to learn about them, really educating yourself in this space, accepting, appreciating, and accommodating different cultural differences, understanding the effect of your own culture on relating to others, and where those biases might be and why they're there, and starting to really dig a little bit deeper. Actively, and then you get to the point where you're really actively seeking knowledge about other cultures and educating oneself about cultural differences. Again, I want to highlight that the you're never going to know everything, right? And so you've got to get past that piece, and really lean into that concept of constantly trying to learn and educate yourself on these different areas. And this is just a different version of what I just talked about, but I wanted to highlight one piece in particular of this, and that is the cultural destructiveness. Now, when I talked about earlier this piece about viewing people as superior to them and not really having that cultural awareness, that's really where that comes in, because what that does is push individuals to what we call assimilate, which is to try to be like everyone else within whatever culture they've been planted into for one reason or another. And so that can be problematic because of a number of different factors. People really lose that history, what they're tied to, their identity. A lot of times those cultural norms and the way we view the world is very much tied to our identity, and how we view ourselves in the world as well. So really, it's really important to focus in on those areas and push past that piece and really have these conversations. Barbara, I wonder if this might be a good time to talk about cultural humility. You're on mute.
The infamous mute and unmute button. Sorry. Sam has done a great job providing with great information about cultural competency, cultural incompetency, etc. She's highlighted how important it is to continue to add to your knowledge and information. And that brings in another concept that I think is really, really important to always highlight and discuss and share when talking about cultural competency, and that's cultural humility. Cultural humility is that concept that helps us to understand that in the space of growing, learning, becoming competent, adding skill sets, etc. And Sam's going to talk to you a little bit later about actual tools that you can utilize to help you in your workspace to be sensitive to the cultural differences of the people that you serve. It does bring us to a point of understanding cultural humility and knowing that this particular term is and concept is so important. It involves us understanding the complexity of identities. We're all unique, even within the culture that we are from. Cultural humility involves understanding the complexities of identities. It helps us to recognize that even in our sameness, there are many, many differences. So I think I saw someone put in the chat that there's not a lot of different cultures within my nursing facility. Well, I want to introduce to you again this concept of cultural humility. Even in our sameness, there are many, many differences. There are various differences amongst us. And as people, individuals, professionals who serve our residents, our patients, our clients, whatever capacity we're working in, we will never be fully competent because of this reality. But we will continue to evolve and learn and grow and share with one another our differences and learn from one another our various differences. Um, the people that we work with have dynamic natures and experiences. And the only way that we are able to learn and understand these differences and experiences is really by honing in again. You know, we've emphasized and talked about the 4 M's, age-friendly health systems, throughout this 24 weeks that we've been together. And what matters most, I believe Sam and someone else mentioned that earlier today in this training hour that we're in now, that that is where it is as it relates to really engaging and understanding the people that we work with and serve. And sometimes if if something happens and we may reflect back and wonder why this patient is behaving in this way, reacting or responding in a certain way. What matters most? Ask them the question: what's going on? What's happening? Why did this happen? And I think it was Justin this morning who even asked the question: what do you do when you make a mistake, or when you approach or do something that doesn't reflect cultural competence? Well, the first thing, obviously, is to apologize, to talk to the person or persons that you've worked with. And this includes staff as well. And then learn from them, ask that question. And if you're working with a resident who's not able to respond, who can't provide you with that information, then seek it from their family, their circle of supports, those individuals who know them best. So again, just this is a concept. You can learn even more about cultural humility yourself as it relates to cultural competence. It doesn't take the place of us striving to be competent in this area, but it definitely needs to be included in the discussion and conversation and in our realm of reality as it relates to cultural competence.
And I think, when we talk about the humility piece as well, Justin, you asked a really good question earlier about what do we do when we mess up? What happens when we screw up the situation? And what I would say to that is, it's really important to not just say, I'm sorry, and move on. Really lean into that, really be deliberate about your actions, and educate yourself on that, whatever it was that you messed up in that situation. And that extends to staff as well. So situations that you might be working through with your staff where, boils down to, a difference within the cultural piece as well, and having that conversation. And then I also want to highlight as well that when we start talking about cultural competency and really building this up, this framework for it in our nursing facilities, it's really important to look at a number of different areas. And I'm not going to go through this whole thing. This is more of just a guide for this piece, but the knowledge piece, really helping train staff. Anybody who's going to be working with individuals at your nursing facility, for that matter, whatever that looks like for your site, helping to train them in this area, really focusing on those, attitudes and that reflection piece, that critical awareness. I actually have a tool that I'll share with you towards the end of our session today, and we'll send you the link as well in our follow-up email, but it focuses on those implicit biases that we might have, that are not necessarily those things that we're completely aware of, that we're struggling with. It's those deeper things that we have a hard time often articulating, but we might know in a particular situation that we just feel a little discomfort with the situation. And so I really encourage you to go through and do that. I've done it a couple of times myself. Just to check in, because it also provides you like some food for thought on the different areas. And then there's that skill development piece too that I think is really important. So how do you deal with the patient-centered piece of the puzzle? How do you have that cross-cultural communication piece? This is all really important moving forward in terms of the care that you're providing. And I think, one of the key takeaways that I want you to have as well is that cultural competency is very much in alignment with a lot of the things that we've already talked about in the past 24 weeks, 23 weeks. And it can really help in terms of the reduction of health disparities. It can really help in terms of those really just improved patient resident health outcomes. And you might be thinking, well, how are those things related? Well, you're really creating this safe space for the individual. You're creating a space where this individual feels comfortable, in the decision making that's going on related to their care. Even if they're not able to make those decisions anymore, perhaps they have dementia or something of that sort, where they're not able to really engage in the same way they once were able to related to their care. Their family feels this, and they're able to, make those decisions within their care and feel safe. And then I just wanted to highlight within our healthcare organizations, which our nursing homes all are, we really want to strive to value diversity and similarities among all persons, really understand and effectively respond to cultural differences. This can be happening on a more macro level within the nursing facility or a micro level. You might see these in very small areas of a resident's care that they're struggling with, going back to the medications or the mentation piece, understanding those issues, talking about them and figuring out solutions. Engaging in cultural self-assessment at the individual and organizational levels is really important. Again, I have that tool that I'm going to share with you at the end of our session that goes over some of this. I would encourage you to also figure out a way to have your staff do this as well at your facilities, and build in some sort of training to talk about cultural competency. Also, really spending that time thinking about your processes and the work that you're doing at your facilities, from intake all the way to that end of life care piece. What does that look like? Are you honoring, or do you have the space to have the conversations about that individual's care as it relates to being culturally competent if things come up? Are you building in those procedures where you're honoring that person's cultural wishes, their values, their norms into that whole journey? And some simple things, even at the beginning of intake, might be better learning about that person. Is English their second language if they speak English? What does their cultural background look like? What's their religious background like? I think that can be really important. I was sharing with the morning group, morning cohort, that I was, this was prior to COVID, but I was working with a nursing facility where we had a couple of residents who would not eat the food that was part of the congregate meals every day. And it came down to, and this again became a miscommunication between the residents and their family and the staff at the nursing home, wherein they needed kosher meals, and that was part of their values and beliefs, and that wasn't being provided to them because they had not asked those questions at the beginning. So they had made a couple of preferences related to the food that they liked or preferred, but the meals were not kosher, and so they were not eating them because of that, or eating only some of them because of that. Again, it was just a miscommunication. The facility was more than happy to help, attend to this particular need, but because they didn't ask it in the beginning, it became this whole thing that kind of blew up a little bit. Making adaptations to delivery and service delivery system and enabling supports. Again, that's a really important aspect to all of this. Like I mentioned with this example I just said, about the food piece, trying to figure out, what's working, what's not, can also be across the board in terms of the care being provided. Dr. Citrone, I don't believe she's on right now, but she gave a great example earlier of this morning in the morning cohort about a female resident who only wanted to see female providers or female staff, due to some, norms in her culture as well. And there was a situation where she needed to have some sort of scan. And the only person who could do that was a male provider. And it was a situation where they kind of had to negotiate this particular situation and kind of communicate and figure out and make some adjustments because of that situation. In some situations when we're providing care, the care is, we view the work that we're doing is sometimes emergent, right? Like we need to make sure that this happens for this individual in this timely fashion. Things like medications or get it, like for example, the resident with a scan. All of those things can be very important, and we, are on a timetable. But when we're working with residents and their families, sometimes those things where we need to communicate and get through them and negotiate those different pieces of the puzzle don't always happen on that same time frame. So it's important to keep that in mind. We also want to institutionalize cultural knowledge, and really that focus on investing the time in the intentionality about increasing your knowledge about various cultures and making sure that that is a system-wide philosophy. And it's not that, again, the philosophy is not that everything, but it's that you're leaning into learning about different cultures and about, some of the different values and norms of those cultures. And then again, I think we pretty much went over this time and time again, but it's unrealistic to think that we can gain in-depth knowledge about how different cultures react in different healthcare settings and what those practices and beliefs are for everyone. But it's valuable for us to really spend that time and investment in developing our knowledge in this area. I'm also going to go over the LEARN model, which is a communication framework that can be used to help providers across different levels of care, including nursing facilities, improve their communication, really focus in and critically think about those cultural issues in care, and then help the individual really, accept that care. And the way that the LEARN model works is it is based on, backwards, step forward, there we go. It's based on 5 steps. So listen, explain, acknowledge, recommend, negotiate, LEARN. It's a really great acronym, right? Especially since I've been talking about LEARN all day today. So in terms of listen, it's really listening to your residents and their families, trying to help understand what the challenges are for them, but also, listening for those values, right? Listening for like, what are those things that within their culture they value? I think that would be really important in terms of that first step, and can also really help that resident and their family feel validated. E is explain. So really from your standpoint as the staff member providing the care, explaining the importance, whether it be, let's use the example of a medication. If it's a medication that, this person doesn't want to take, explaining why it's needed in a very easy to follow way, so that that person understands the kind of the nuances of the medication piece. Acknowledge. So acknowledging what that resident and or their family is telling you about their belief system, and understand or acknowledging that there's a butting of the heads related to these 2 values. Make a recommendation, taking into mind and that acknowledgement piece, what that person feels comfortable with, and then understanding that they might not necessarily take you up on what you've recommended in terms of their care right off the bat either, and building that rapport and negotiating with them about this, and I think sometimes it comes down to that particular piece. I was sharing in an earlier session, now this wasn't necessarily a case study from a nursing facility, but I think it has application to the work that we do in our nursing facilities, because it is focused on the reluctance within some cultures to take medications for different belief systems that they have, but also shows how our system sometimes does not explain things thoroughly. So this particular case study was a provider who was working with an older adult gentleman who was Hispanic. He predominantly spoke Spanish, so when they would have appointments, he had an interpreter. And he found, the person had glaucoma, so he had prescribed to the older adult drops to use. And through the course of, I think he was supposed to see him 3 or 4 months later, the person comes back for the appointment and he's not been using or adhering to the drops, and his vision has rapidly declined because he's not been adhering to this, and then also taking care of himself. And part of it was because he got home and was very confused by the instructions. They were all in English. He couldn't follow them. He had somebody help him interpret them. But the one of the problems was also that he felt like, oh, well, these aren't working anyway, so why am I using them? Because, he was within his cultural norm, it was, oh, well, if this doesn't work, like a Tylenol and eases my headache, then it's not working at all, so I'm not going to use it. And he was shocked to learn that his vision had declined, or was declining more rapidly than it was before. So, really helping, I think this really illustrates helping residents and their families better understand some of those unique things that are going on with them as well, can be helpful. I think we've covered all of these pieces, so in the interest of time, I am going to skip ahead from that one. But I did want to share with you, this is a guide for all of you. You can download. It's about becoming a more culturally competent organization. We will also give you the link for this. This is the QR code that you can use to download. But it really walks you through a number of different steps. One, I want to highlight, this is from that particular document, just the benefits across the board to becoming more culturally competent, in terms of that social piece, really, promoting that inclusion and that trust, and increasing that within the nursing facility, that community aspect of the care that we provide. And it really helps give those residents and their families that voice in their care. It can also, in terms of the health benefits piece, really help, especially from a resident care standpoint, that preventative care piece. If we're talking about, the medications, or we're worried about falls and their use of adaptive equipment, really keeping them out of the hospital or down the road. And it can also, really just across the board help in terms of, you've got that buy-in from them. You can better measure some of these outcomes that you're doing across the board with your residents. And then it also has, when we think about our nursing facilities, it really speaks to, that concept of, we want to be a culturally competent nursing facility and market ourselves in this way. And really shows that how important that can be in terms of this benefit. And then it also walks you through the great aspect about this document. It walks you through some of the different steps. So how to do a cultural assessment of your organization, how to really focus in on the staff aspect of that knowledge attainment, how to develop that ongoing education. So again, we've talked about cultural competency being on a continuum. And so we want to make sure that we're doing that ongoing investment into the space. And then tracking all of this as well, to make sure we're staying on target, because that is something that's important to us moving forward. And then another good starting tool that I wanted to share with you all, and I mentioned this earlier, this is the Harvard Implicit Bias Test. You can, the one that, and Justin put the link in the chat as well, but the one in the left hand corner of your screen that talks about social attitudes is really that great starting point that I was talking about, really to help you have this kind of understanding about what are your biases, and dig a little deeper there. There's also a number of other tools on this as well. There's a guided toolkit once you complete the social attitudes piece that can help drive that conversation as well. And then, another great tool that, not necessarily relevant about this, but to this particular topic today, but about healthcare in general, and some of the biases that we have in that particular space. So check this out. I highly recommend it. And then I wanted to leave us with a final thought today, and that is, we talked a lot about the cultural competency piece from the standpoint of age-friendly healthcare systems, but it also is integral to just quality care in general in our nursing facilities, because it is so imperative that we're being person-centered and providing that care to the residents that we serve. And so adding or infusing that cultural competency piece can be really, really important to that space. And with that being said, I think that's all that I have. Does anybody have any questions? Any comments?
Thank you, Sam. Thank you, everybody who's spent the last 24 weeks on Thursday afternoons with us. We really appreciate it. I'm going to put and for some reason I put it in there twice, but basically the session 24 survey, you can either use the QR code or you can click on the link. Please fill that out. We will be in touch about the weekly or the monthly sessions that start on Thursday, August the 4th. So we hope you will join us then. Again, Pam had mentioned the advanced care planning emails that went out to nursing home administrators and data staff. So please be on the lookout for that. We really appreciate your time and we really appreciate you filling out those surveys. So we'll stay on for a few minutes if you have any questions or comments. Otherwise, we hope you have a great rest of your week.